Hello, my name is Matt Piercy. I'm a faculty member at Yavapai College. My academic training is as a virologist. So what I'm doing is building a series of videos that are going to address the biology of the coronavirus, potential treatments that are on the horizon and how they function, and then lastly, we'll build some videos talking about the current state of the pandemic. So in this video, what we're going to do is talk about a treatment for coronavirus infection that just started clinical trials. The Food and Drug Administration approved this treatment last Friday, and Johns Hopkins University is conducting the clinical trials of this treatment. So if you look at the bottom of the slide, there's two different sources there. The first is from the Journal of Clinical Investigation. That's where this figure that I'm talking about came from. So if you're interested in this topic, this journal article goes into a lot more detail about how this process works. If you look at the bottom link there, that is a link to an article that talks about what Johns Hopkins University is currently doing. So the first link is all about the science, and then the second link is how it's being implemented right now. So to start this off, what I want to do is go back to the last video that I made that talked about, in very general terms, how coronaviruses infect our cells. And if you didn't see that, I'll put a link for it in the description for this video. Basically, the gist of it is this. In order to get inside of our cells, the coronavirus spike proteins have to bind to a protein on the surface of our cells called ACE2. That's how the virus gets inside of our cells. Our immune response makes antibodies to those spike proteins. Those antibodies bind to the spike proteins and prevent the entry of the virus. So in other words, antibodies to coronavirus are going to bind to the coronavirus and prevent it from actually getting inside of our cells. In a normal natural infection, like we talked about last time, that takes a couple weeks. And in that couple weeks time, people can get pretty sick or even die. So building on that knowledge is what we're going to use, or using that knowledge is what we're going to use to explain this figure here. So this figure is basically talking about how we can use antibodies from people who've already recovered from the coronavirus to treat other people who are currently sick or who have been exposed but aren't sick yet. So the process works like this. If you look at the top left-hand side of the slide, you see that figure there that says COVID-19 patient. So this is someone who is currently sick with the COVID-19 virus. They have a current infection, they're currently sick, and then hopefully that person is going to recover. And when that person recovers, they're going to have antibodies to coronavirus in their bloodstream. That's what enabled them to recover. Now, if we look at it from the current state of the pandemic, today there's been roughly about 330,000 Americans infected with the COVID-19 virus. And the vast majority of those people are going to recover. So there's a large number of people very, very soon who are going to have antibodies to coronavirus or to the COVID-19 virus in their bloodstream. So what we're going to do is essentially harvest those antibodies from the people who've recovered from their COVID-19 infection. So like you see there in the figure where it says draw blood, we'll simply take blood from the people who recovered from the COVID-19 infection, and inside that blood, they're going to have virus neutralizing antibodies. So those antibodies are going to be taken from the blood of the person who's recovered from an infection. Now here's why that's potentially so valuable. We know that it takes a couple weeks to really make high levels of antibodies on your own if you've been infected. But if we take antibodies that have already been made, we can immediately inject those into someone who's just been exposed or is currently sick. And so we can give them antibodies essentially instantaneously, long before they can make them on their own. But those those antibodies will do the same thing that the antibodies did for the original person that was infected. They'll bind to the coronavirus and prevent it from entering into our cells. So that's exactly the strategy. We'll take serum containing those antibodies and we can use it to treat two different types of patients. So if you look at the right-hand side of the figure there, both of those are labeled. So we can use this treatment for what's called prophylaxis. So these are people who we know have been exposed to COVID-19. We're not even sure if they're truly infected yet. They're not sick. They're not showing any signs or symptoms of infection. But if we know they've been exposed to the virus, what we can do is give them some of those virus neutralizing antibodies. Their body hasn't had time to make any antibodies, even if they were infected, but we can give them to them as a treatment. So those antibodies will circulate in the person's blood who's been exposed to COVID-19, bind to the virus and prevent it from ever infecting that person's cells. So in the best case scenario, that person would never get sick. So we can also use those antibodies for a second purpose, and that's called therapy. And you can see that on the right-hand side of the slide. This is an actual COVID-19 patient, someone who's currently sick from the virus infection. So what we can do as a function of this therapy is give the person the same antibodies that we purified from the person who was sick. And what these antibodies will do is bind to the COVID-19 virus inside of the patient, prevent those viruses from entering into the cell and making new copies. And hopefully that will aid in the recovery, or at least shorten the time that the person is sick from the virus infection. So that in a nutshell is how antibody therapy is going to work. And this isn't something that's completely brand new. We've been doing this since the late 1800s. Antibiotics weren't put into widespread usage until about 1940. So the way we treated some illnesses like polio, flu, among others, was essentially this technique right here. And people that are exposed to rabies, and have to get treatment for that, the treatment that they get is essentially this process. So this is a method that's been used for well over 100 years to treat different kinds of infections. And so what we're going to do, like I mentioned earlier, the Food and Drug Administration approved this as a treatment for COVID-19. So the whole treatment process has went into clinical trials. It did last Friday, April 3rd. And so in the next few weeks, maybe a couple months, we'll see if the treatment is effective for this virus, and then we'll see if that gets scaled up. So that's the biology behind one of the possible treatments that are currently in clinical trials for COVID-19 infection.